All right. Good evening, everyone, and welcome to day two of our ATP 7th anniversary online conference. Thank you so much for joining us. I can see that people already joining us from Instagram. Welcome. You will be able to see my speakers, but you'll be able to hear them for those of you on Instagram. For those of you on Facebook, on YouTube, on Facebook groups, Facebook pages, you'll be able to see, you'll be able to hear them. And today is a very practical session. And yesterday we talked about the health of our children, why our children dying, and all that. But today, one of the issue we raised is the issue of finance, issue of paying for health. And so today we're going to have the experts in the house, and they're going to be talking to us about. I'm sure most of you have seen the bio profile. I mean, these are experts of many, many years in the industry, from the government end and also from the private end. So we have everybody in the studio, and they're going to talk about the health financing. What are the practical solutions? How do we ensure that our children survive despite the economic downturn, despite all the challenges of paying for health care? So they are going to be giving us practical solutions. So welcome, welcome, welcome. My name is Gbemisola Boyede. As always, it's my pleasure to be here. It's my pleasure to host our wonderful guests, which I'll be bringing up to your screen very soon. But before we do that, I just want you to share the video. Make sure all the videos are shared and pinned in all the various locations. And I'm also just going to try and do that very quickly in the next few minutes before I introduce my guests to you. I just want to make sure I share the video myself. So welcome, 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 everyone. Welcome. So in the next 2 minutes, let's just try and share the videos, making sure that everybody can see it. And I'm trying to look for. I'm trying to look for my own video myself. Okay, so please just share, invite your friends, and let everybody come and join us today. Okay, thank you so much, everyone, for joining us. Okay, I can't find my video, but I'll go to his Facebook page. So welcome, welcome, welcome. I've got our guests already in the house, so you will be seeing. Okay, here I've seen my video now. I can share it now. Okay, lovely. Okay. So I just want to share to our groups, make sure that everybody, especially in our other groups where they can tend to see also, just to make sure they can see. For those of you on Ask a Pediatrician Facebook group, I'm sure you can see me already. And you can start asking your questions away, anything about finance. So today is not the day to ask about pediatricians' questions. So today is to ask the finance experts when it comes to health. All those things you always tell me about, like cost, finance, poverty issues, about paying for healthcare, where do you get it for cheap and all that. So today is the day for you to have that conversation. Okay, so I'm just going to make sure that all the videos are pinned in the right places, so then we can start. Come on, come on. Okay. Um, Welcome, everybody. I can see you. You're welcome. You are on to ATP and 7th anniversary online conference. Today is day two. Yesterday, I had my wonderful pediatricians in the house, Dr. Nnenna and Dr. Uche. And we had a wonderful discussion. And today we are having the financial experts coming to talk to us about how to pay for the health of our children. All right, so I think I'm almost done. One more. Okay. All right. Okay. I think we're done now. So let me go back. So welcome everybody. I can see some of you already joining us. So welcome once again to ATP Live. Today is our anniversary, 7th anniversary online conference. Today is day 2. We're talking about how do we ensure our children's survival in line with the Sustainable Development Goal 3, which is about health for all, especially our children, and especially in this situation where there's so much financial crisis all over the world, things are so expensive. How do we pay for health? And why is the government telling us that health is free, and when we go to government hospitals we don't get it for free? How do we balance that? Okay, so it's time for me to introduce to you my guests. They are here. Dr. Awoyinfa, let's see your face. Okay, it's time for you to meet my guests. Okay. Okay, let me start with Temilade. Okay, maybe I should allow them to introduce themselves to you. Okay, I'm sure you've seen the Bao profile, and but I think maybe it would be better hearing from them and what they do, so you know who the experts are talking to you today. So, can we start with Temi? Do you want to tell us who you are, what you do? For those of you on Instagram, just listen. I'm sure you can hear her. So, just tell us who you are, what you do. Thank you.
Thank you very much, Dr. Gbemisola, and thank you for the opportunity to speak to members of ATP. And my name is Temilade Daniel-Owo, and I work with the HMO Leadway Health, to be precise. And I have over 10 years experience in the health insurance industry. I started my career with a previous HMO before I moved down to Leadway Health. And I'm a core salesperson with Leadway Health. So I'm a business development person. I sell health insurance. I make you understand, help you understand rather, how health insurance will be of benefit to you as an individual and as a citizen of Nigeria, how you want to live, have a sustainable financial, how to manage your finances better when you have health insurance and one of the insurance packages available to you. So I thank you for this platform, and I'll be explaining how the availability of this product in Nigeria can be beneficial to us all. Thank you once again.
All right, thank you. I don't know what happened to my camera. Okay, but so thank you, Semi, for coming on the show. Uh, just a minute. I don't know what happened to my camera. Okay, sorry. Don't worry about me. Just come. I hope you can hear me, though.
Yeah, we can hear you. We can hear you.
Yes, we can hear you very
I don't
well.
know what happened to my camera. Can you just give me 1 minute to refresh?
Okay, no problem.
Just
Okay,
don't worry. I'll be back in a jiff.
okay.
Hello, sir. Hello, sir. Let me call you back, sir. I'll call you back now. I'll call you back. Hello, Dr. Gbemi. You're on mute.
Sorry. Thank you so much. Sorry. I was trying to do some other things and I think it upset my setting. All right. So
Okay.
we've heard about Tammy. She's an HMO expert. She sells health insurance and she's been doing that for over 10 years. Thank you, Tammy, for coming to our program. We really appreciate you. All right, Dr. Awoyinfa, do you want to introduce yourself to us?
You didn't start by saying that we are classmates now. That's the first. That's the first thing.
Okay. Yeah.
So,
You
I'm
told them.
happy to be here. I've known about ATP for 7 years now. Dr. Gbemi and our team have done a fantastic job. So
Thank
when she
you.
called me, I had to jump in. And like I mentioned earlier, we went to med school together, and
Mm-hmm.
Gbemi was, like I said, the smartest person in my class, doctor.
Mm-hmm.
And for some of us that were not as smart as Gbemi, we couldn't go and specialize. So for 15 years I've been in health insurance. I've set up a couple of HMOs. But what I do now is manage healthcare for companies and even for state governments. So essentially that's what I do. I advise people on different innovative ways to finance their health. I also manage health budgets of some multinationals, and that's just to contribute our own little quota to making sure everybody has universal health coverage. So it's good to be here.
All right. Thank you so much, everyone. So, thank you so much. We have the experts in the house, and the topic, like we said, is the practical solutions for paying for our health, when it comes to the health of our children. I'm just going to give a little bit of the background. Most time when what we do on ATP is to try to support parents, make sure that our children survive. We are looking forward to that day when no child in Nigeria will die from preventable causes of death. Like we talked about yesterday, most of the things that are killing our children, they are things that are treatable, they are things that are preventable. And so it's always like our projections were telling us yesterday. So it's always so painful when we see children dying from malaria, from pneumonia, from diarrhea. These are things that we have preventable strategies for. These are things that we can easily treat. And one thing I found out that most parents struggle when they come to ATB, they ask a lot of questions and they're like, why are you not going to the hospital? Why are you not doing this? And it's always like, I don't have money, or I don't think I can pay for it. And then when you go to the government hospital, they waste so much time, and they may not even attend to you and all that. So, and because can't afford private, the government is also too busy, not affordable, or not. I mean, they don't give you the quality of care that you need. So these are the challenges parents are facing. I believe that most parents wants the best for their children. Everybody wants their children to be healthy. Everybody wants to take their children to the hospital when they are sick, but paying for healthcare is always an issue. And then most parents resolve to doing self-medication. They resolve to going to the chemist shop. Not even, some of them are not even pharmacists, because most of those shops don't even have pharmacists. So, and then they will just let them go and use this. And sometimes they worsen the problem rather than provide solutions. So this financial paying for health is always a major challenge. And we've had politicians, especially now that's the election period, promising us free healthcare, free healthcare, free everything. But we all know that it's nothing is free. And people are always telling me that even immunization that I always tell them is free, they go there, they tell them you have to pay for gloves, you have to pay for this, you have to pay for that. So people need solutions, and that is why we are brought you here as our experts to tell us the solution. We also have a third expert in the house, Dr. Nnenna Kalu. She works for the National Health Insurance Authority, but she's unavoidably absent, but she has sent me a presentation, so which I will play along the line. But before we do that, what I'm going to do is to give our speakers an opportunity to present, to talk to us generally about paying for health or whatever they want to say. And after that, we will now start taking your questions. So if you have any questions, feel free to drop your questions and then we will take them. But I think we should just listen to them first, and then we can now start taking questions. So today is for you to ask questions, having given the background. So I'm just going to ask Dr. Awoyinfa, because I think you sent us a presentation. Do you want to take your presentation first?
Yeah. Let me so that Temilade has more insights nowadays. So
Okay.
let
Okay,
her not
fine.
let
Then
her
you
not
want to go first.
outshine me.
Okay.
Okay.
Okay, let me start by when people hear what is health insurance really? So health insurance is how financial resources are used to ensure that the health system is adequately covered for all in a collective need. So a group of people or a number of people, they put funds together. It's more like if I want to go to the colloquial language, I might say okay, maybe like another form of a job. People put money together whereby if there's a financial need for a particular person, then from that amount of fund put together, you're able to pay hospital bills. This hereby reduces the burden of an individual if he or she gets sick or needs a form of healthcare intervention for their dependents. And in Nigeria, for instance, penetration of insurance as a whole is quite low, not to talk of health insurance. Insurance as a whole, its penetration is about 5%. Then when you now trickle down to specifics and come down to health insurance, penetration is like 3%. There are a lot of things that have made insurance not go not that don't have that kind of high percentage of penetration. When I say penetration, I mean the number of the population that has health insurance in Nigeria. So out of our population of about how many million? I think about over 200 million Nigerians. Not more than 3% of
200.
Nigerians. Say that again.
No, 200
200, right?
million, yeah.
Yes, over 200 million Nigerians. Not more than 3% of that figure have a form of health insurance, a health insurance policy. And most of the people of that 3% that have health insurance are majorly from employee benefits. So from their offices that these health insurance policies are purchased for them. So health insurance on its own is very low, and a lot of things have made it not have that kind of high traction that it would have had compared to other countries that want to run away to that want to migrate to these days, the US, Canada, and the UK. Penetration of health insurance in such countries is very large. That's one of the things that makes such countries their economy is good. When I say their economy is good, Harvard did a study whereby they checked one of the major things whereby people get bankrupt, and medical expenses was one of it. That where people now declare bankruptcy, medical expenses is one of it. So if you have health insurance, you are in a way mitigated against whereby you are now getting bankrupt. You've provided solutions to your need, whereby the money you actually work for, you enjoy it. You're not using it to sort one healthcare need or the other. So we see on Facebook, we see on Instagram, whereby people say, "Oh, come and donate funds for this person. The person needs to do a kind of particular surgery. It goes into millions and hundreds of millions of naira. They can't have that kind of fund." Health insurance can, in a way, mitigate that burden, help provide a solution to that burden, and I will explain it as we go along. Let me not say all of it in one.
All
Presentation.
right. Thank you so much. That was quite very is I think you have I kind of explained to us, I mean, why health insurance can help us kind of reduce these challenges. Okay, like I said, I will allow all our speakers to speak first, and then we'll start having questions. I can see the questions I've said dropping in. So if you ask, they are talking, please be dropping your questions, and they are in the house. Okay, Dr. Awoyinfa.
Yeah, please, can you put up the slides, please? So I can
Yes.
just, in 7-8 minutes, just go through a bit of what Temilade spoke about. We'll talk about
Uh,
health insurance in Nigeria, then other parts of Africa, then what are the options? Like you said, what's the way forward?
hmm. Okay, so I'm going to start sharing the slides now. Okay. Yeah, so your slide is on now.
Okay, please move to the next slide. So this is the outline. I'll be giving a brief history of health insurance, health financing in Nigeria, and different ways to pay for healthcare. You know, Dr. Billy mentioned earlier the federal government, the state government, the local governments. They're the most popular one in Nigeria now, paying out of pocket. Most people in Nigeria, about 70% of the population, they pay for their health out of their pocket. Then there's private health insurance that Temilade mentioned, which the penetration is very low. And I wanted to add that it's not only in Nigeria that it's very low. In the whole of Africa, only 4 countries have penetration of more than 20%. You have Rwanda, Ghana, Burundi, and Gabon. And it will interest you to know that all these countries are not very large countries. For example, Rwanda has a population of 12 million. Ghana has a population of about 30 million. Gabon just 2 million. Then Burundi, I think they are less than 10 million. So what does that tell you? That unless government worldwide is in charge of financing health, it's going to be very difficult for people to pay their way at the health center, whether public or private facilities. And it's not only an African problem. In the US, healthcare is a major issue, whereby we are following, in Nigeria, we are following the HMO model, whereby if you don't have an HMO in the US, you don't get healthcare. But the system is funny in the US because at the point of an emergency, when you're probably unconscious or you're at the risk of dying or permanent disability, the government covers you. But until you get to that point, the government doesn't cover you. Unlike in the UK, where everybody healthcare is free. So if you see people in the UK and US talking, you'll be wondering that two of you are in the Western world now. What? How come you are paying? Because there's this joke I will share with Dr. Gbemi, a skit about an American that went to the UK, and for 10 minutes he was arguing with the doctor that why are you not going to charge me? And the doctor in the UK said, charge you for what? That we don't charge people. He said, no, you must be joking. That you must charge me. I said, no. So the point I'm making is that health is supposed to be free, but somebody has to pay for it. And the problem we've had in Nigeria is that we have not defined who is paying and what they are paying. If government is telling us that, okay, healthcare is free, but at the same time, they are not providing consumables for public hospitals, the nurses and the doctors and the other paramedics will find a way around it. That's why you find out that the only thing you don't pay for in a general hospital, in a public hospital, is consultation. Everything else, you are going to be charged. Everything else, whether it's needle, whether it's sutures, whether it's drugs for diarrhea, drugs for pneumonia, like Dr. Benny mentioned, somebody has to pay for it. So apart from paying out of pocket and private health insurance, we have charity, crowdfunding, and donations. So donations can come from organizations like Ask the Pediatrician, can come from foreign donors. We know Bill and Melinda Gates Foundation, that are very big in Nigeria. Then you have charity, even some banks. During COVID, Sterling Bank set up a platform called Giving.ng, whereby people go there and put up a certain cause and they appeal to people to donate. There's also a platform called Donate.ng, where doctors can come together or even people can say that, please, can you support my cause and what's it called. But you and I know that there is no way all these crowdfunding, charity, and donations can be enough for a country of 200 million. Now we have another dilemma. Government spending in Nigeria is very low because our revenues are going down. So we are seeing that the money available to government 7 years ago is not what's available today. You have the Ukraine crisis. We're still trying to recover from COVID. There are supply chain issues and what's it called. And government has its hand in so many things. We all know about the strikes in ASU. Then I'm expecting doctors to, before end of this year, because of inflation, I'm suspecting there might be a strike very soon. Because there is no way with inflation at over 18%, the last increment they got, inflation would have eroded it. So some of us in the private sector actually, we are planning, we're already making plans that when there is a strike, what happens? Because all the private ICU become filled. And like I tell people all the time, the only place you can get the most consultants in any city in Lagos, whether Lagos or anywhere, is in a teaching hospital. Any neurosurgeon you are seeing, any pediatrician you are seeing, it's very difficult for any hospital to have as many pediatricians that are available in Luth, LASUT, UCH, OAUTH, that kind of thing. So please, we can move to the next slide so I can give a background on government spending and history of health insurance. So like Temilade mentioned earlier, the best way for most countries to cover for health of their citizens is through health insurance. And even in Nigeria, we've been on this journey since 1962, when the government knew that the only way we can provide healthcare for most of our citizens is through health insurance. So from 62, I've given a brief background. We've been on this journey. 66, the military. 88, Professor Ransom Kuti commissioned the committee. 89, they submitted his reports. This next slide. 93, it was supposed to start. Unfortunately, June 12 crisis. But finally, May 10, 1999, General Abdusalam Abubakar, he gave the first law, Act 35 of 1999, which stated that every Nigerian may or may not have healthcare. So it wasn't compelling enough. And you and I know that anywhere in the world, if you don't make it compelling, there's no way you can fund healthcare. For example, I mentioned Ghana having a coverage of universal health coverage of over 20%. What you would like to know is that Ghana has, out of their VAT, their value added tax, they charge 2.5% for their own National Health Insurance Authority. They charge 2.5%. So that's a way of funding healthcare. And luckily for us, last 2 months, President Buhari signed into law the National Health Insurance Authority Bill, which mandates that every Nigerian should have health insurance. But unfortunately, it's easy to sign it into law, but how do you fund it? So there's what they call a vulnerable people fund in that law. But just before the law was signed, the law should have been financed by a 10 kobo per second billing on every Nigerian using the telephone. And just the day just before they signed it, I don't know why, the clause was removed. So unfortunately, we have lost that line of funding. But the government, a couple of years ago, introduced what we call a sugar tax, whereby for your Coke, your Fanta, your Sprite, any soft drinks as you have it, there's a 10 naira on every CL. So worldwide, they are called sin taxes, whereby governments in different parts of the world, whether Mexico, whether Cuba, all these countries that are also developing like us in Africa, they found out that there is no way government alone can finance health. They have to find a way to, tax some certain sectors that they call sin sectors. For example, there's a tax on alcohol, there's a tax on tobacco, there's also a tax on the rich. For example, if you have a private jet, they tax you that, okay, we're going to use part of these taxes to fund health. So there's no one size fits all for any country or any region. People look for different ways to try and finance healthcare. And I wish Dr. Nnenna was here. She would have told us, a lot of advocacy that has been done over time, that no matter whether Nigerians have 100 HMOs or 200 HMOs, we'll be lucky to have coverage from the private health insurance of up to 30% of our population. It's going to be so difficult because another problem is we have a lot of Nigerians who the economy is not smiling at. So their priority right now is food, transport, accommodation. So the only reason why they want to pay for health is at the point of care. And unfortunately, like Temilade will tell you, at the point of care, your bill becomes so astronomical because God forbid you have a headache and you start treating yourself with local medication. And we don't know whether you're having hypertension, it may lead to a stroke. You have a child that has diarrhea. The parents are scared of going to the hospital or to the pharmacy, so they start doing it at home or talking to strangers that don't have any idea because they are scared that if they go to the hospital, there is no way that they can afford to pay for it. And Temilade will tell you, the average Nigerian likes healthcare. They want to pay for health insurance, but they will just tell you that I don't have the money. My money is going on other things. So that's where organizations like Act the Pediatrician Foundation comes into play. So Lagos State has a health scheme, and what they've done is they've reduced the premium to about, I think it's 8,005 a year, 700 naira a month. So what some organizations do is that they buy health plans for vulnerable people. So you can have like maybe a company paying for 50,000 vulnerable people, 100,000 vulnerable people. But even that comes with its own issue because How do you define the vulnerable people? Are they party members of the ruling party in Lagos? Are they people from the southwest or from south or southeast? Are they people, and nobody can tell you who is sicker than the other. So, for example, we see all the time on social media somebody is trying to raise money for a certain baby or a certain family relation or what have you. So those are the challenges we have. But moving forward, please, next slide. Yeah, so I mentioned this earlier, paying out of pocket. The commonest means in Nigeria, over 70% of people, either the patients or the friends and relations, they pay for health services at the point of care. It is not sustainable at all because it can cause severe economic disruption. I met a lady last week. She said she needed a kidney transplant, and it was going to cost her about maybe 12 million. Very young lady, very young enterprising lady, and she's just 26. So, and she was telling me where was she going to get 12 million for kidney transplant, because she and her family had been paying out of pocket. They had been paying for her dialysis for over a year, and unfortunately, her two kidneys have packed up. So first of all, she needed 500,000 naira to get a donor. After getting the donor, they also matching test. If you're unfortunate and your test don't match that donor, you're going to look for another 500,000 for another donor. We are not talking about the transplant yet. So after the test, then we now start talking about where do you want to do it? You want to do it in Lagos, or do it in Abuja, and that kind of thing. So paying out of pocket exposes people to a lot of uncertainty and losses, and they undergo life saving treatment which they may not be able to pay. And I'm sure Ask the Pediatricians have seen that a lot, whereby we have some children that need neurosurgeries and unfortunately they can't pay for it. But since the coming of the NHIS in 99, private health schemes have risen, promoted by different HMOs, and most of them run the managed care system. The managed care system essentially means, you pick a hospital close to where you live or where you work, you pick a health plan you can afford that has a defined set of benefits and financial limits, and you can access care. And the HMO is responsible for paying the hospital as long as the services are rendered within the scope of the health plan. So the good thing about the HMO is that you have a bit of leverage, provided you don't have any long-term or chronic disease, which your health plan might not be able to cover. But like I always say, a part cover, a half cover is better than no cover at all. So you find out that people that work for companies are very lucky. Whether you're a factory worker, you work for a multinational, you work for a company that has 10 employees, a lot of private sector employees are embracing this option as a cost-saving mechanism. And it also helps to ensure quality because the HMOs make sure that the hospitals have a certain level of quality that they have to adhere to. Every year, the HMOs go about, make sure that you meet some certain criteria before they can allow their people to use your hospital. And you have very few private individuals who subscribe on their own. So, for example, the biggest HMO in Nigeria now probably has an enrollee base of less than 500,000. And meanwhile, we are 200 million. So you can see that no matter as much as the HMOs try, they've not been able to capture a lot of Nigerians. So if you have, for example, we have over 60 HMOs in Nigeria, and the biggest one of them will have less than 500, between 400,000 and 500,000 enrollees. I know they are not trying. They're marketing on radio, on TV, on social media platforms, and what's it called. But the traction is just not there. So next slide, please. Other options, we mentioned charity, crowdfunding, donations by organizations like Ask the Pediatrician, but unfortunately, this also suffers from setbacks. There's a general lack of trust in the society. So if somebody comes to meet us now and say, I need 2 million for my child to have a surgery done, my child has this condition or that condition, and they need money. Nobody is going to want to give them more than a certain amount. There's also the speed of fundraising is very slow. The child might need immediate care. Unfortunately, the emergency situation might not allow you to, what's it called, to start fundraising for a month or two. And the most important factor of all, the low economic power of donors. We hear on the time, on the radio, on the TV, that a certain number of Nigerians are below the poverty line. So Nigerians like to give, but if they don't have, there's no way, there's no way they can give you what they don't have. So that's another problem with this option for payment. Then Dr. Nnenna's company organization, the National Health Insurance Authority, they have to scale up their activities. Also at the state level, we have over 25 to 28 states now that have their own health insurance schemes. Now that health insurance is compulsory, government needs to make adequate provisions for funding premium. It's not for one thing for the government to say we are going to cover vulnerable people. The question is, how are we going to pay for it? And I'm an advocate of letting people pay without them knowing. For example, I had a meeting with someone last week, and he told me that one of the telcos had 70 million people using their mobile devices and 38 million using mobile data. But guess what? If I tell you that what the mobile data, what some organizations have done, they make sure that if you pay for your ringtone or what's it called, eventually you pay your data, they take the money little by little so you don't feel it. Because the day you tell them that you are paying 100 naira for downloading this application or for using social media, people will stop using it. So what they do is that immediately you buy the mobile data, they've already put the costs inside. So we need to look for innovative ways on how we can make most Nigerians pay for healthcare without them knowing it. Because if you talk to a lot of Nigerians, they will tell you that I can't pay for food or what's it called, but I have to buy credit. I ask them why. They say, I'm going to buy credit now so I can start begging people for money now. If I don't have credit, how can I? What's it called? But you find out that that kind of person, he doesn't know that if you are buying 100 naira every 2 hours, you are spending more than the man that has maybe a contract line who pays at the end of the month but has the lower rates than you. So Nigerians just know that they have to talk to each other, they have to call their family, they have to call their friends, their offices, their what's it called. So we must find a way. The clause that was removed from the NHIS Act, there must be a way for advocacy for us to return that, because it's a form of funding healthcare. Then also organizations like Agri-Pediatrician have won different awards worldwide. We may need you to also spread your tentacles, to organizations, because you'll be surprised that there are so many organizations in Europe that want to help us in Africa, but they set very, very high criteria before you can access their funds. There's a company called SIF. I don't what's the full meaning of SIF? CIFF. They gave Nigeria, the Children Investment Fund Foundation. It's based in the UK. I will discuss with Dr. Gbemi. So what the man does, he's decided that for the rest of his life, he's going to be funding healthcare in low-income countries. So those are the kind of things we need organizations like Agri-Pediatrician to help. The Agri-Pediatrician is a credible platform, so I'm sure organizations that know them very well can support them and allow them to take care of children who register with the foundation, and we can help them out. So, for example, we can set a target. For example, that we are going to help out 100,000 children who need treatment for pneumonia, diarrhea, surgeries like what's that surgery called? Very common. Is it hypos? Doctor, talk now. You're not saying anything. All these surgeries are very common in children that people can't afford it. So we can set a target for active pediatricians that is your 7th year. Before your 8th year, we want you to intervene in at least 10 to 20,000 children all across the country. So I hope I'll be able to shed a bit of light on the
Yes.
challenges and also possible solutions. Thank you.
Thank you very much, Dr. Awoyinfa. Um, Okay, I think that is a very interesting presentation. I think I have a lot of questions to raise, but let me just play. You were referring to Nnenna quite a lot, the NHIA. So I'm going to play a video now, and after that, we will go into the question and answer session. All right.
Hello, my name is Nnenna, and I am a wife, mother, sister, teacher. I am also a public health physician, a medical doctor, and administrator, and I work with the National Health Insurance Authority, NHIA, in Nigeria. Now, the NHIA, until recently, used to be known as the NHIS, National Health Insurance Scheme, and I'm sure some of you might have heard about that before. So today I'll be talking to you about health, the health system, health insurance, and how you can take advantage of health insurance to pay for your health needs. And that's really important because when we talk about health, it concerns all of us. Health is not just the absence of any disease or infection or illness. It's also about the absence of, it's also about the state of complete physical, mental, and social well-being. You have to talk about the financial aspects of health. It's really important because a lot of people feel that they are comfortable, they have enough money, until one illness comes from somewhere and just wipes away all those funds that they thought they had that will carry them for several years or months, as the case may be. So now, the important thing to ask ourselves is how can we make sure that people have good quality health care and they do not fall into poverty while trying to access that health care? Well, to be honest with you, it takes a whole system to be able to solve that challenge. It's not something that just one individual or one organization can take care of. So it requires a whole system. You need a structure, leadership and governance structure. And that means that you have different organizations at different levels that are coordinating different aspects of healthcare. For instance, you have the Federal Ministry of Health and some of the MDAs like the NHIA, the National Primary Healthcare Development Agency, and the NCDC at the federal level. You also have state level or subnational organizations, and then you also have some institutions at the local government level. And so all these are structures that are supposed to help to coordinate and to make sure that things are being done. And then we also have the human resources, very important. You must have adequate number of doctors, nurses, community health workers, pharmacists, laboratory scientists, and technicians, enough to man those healthcare facilities, enough to go around all the people, and they need to be evenly distributed. So that's important as well. You also need to have the requisite drugs or medicines and equipment, vaccines. That's important. They have to be stored properly and distributed again. And then, of course, you need the health management information systems. But critically, you need money. You need money to be able to pay the staff. You need money to be able to run the organizations. You need money to be able to make sure that when people get to the healthcare facilities, they are not turned back because they cannot afford to pay. So the health system, I've talked about it, is all those resources and all those organizations put together. And we just try to, recognize them as supply side and demand side. Supply side are supplying those things that you need to run the system, the human resources, the vaccines, the drugs, and all that. And then the demand side, make sure that when you go to the hospital, you can actually demand for services. It's your right because you can afford to pay. And that's where the NHIA comes in. But there are several options before we get to the NHIA. If you want to pay for healthcare, you can decide to take any of these options. Number one is paying out of pocket. What that means is that when you get to the healthcare facility and you have a challenge, you are asked to pay there and then for the services that you're going to get, whether it's a lab test or to see a consultant or whatever. So the challenge with this is an option anyway, but the challenge with this is that at the time you're getting to that place, you may not have enough funds to pay, or you may not even have any funds at all, because the truth is that illnesses do not give advance money. And when you do not have enough funds to pay, you may not be granted those services. So a lot of people have resorted to borrowing, to begging, to managing, going without the requisites or the treatment that they need, and then coming back much worse off when they have tried all sorts of alternative remedies that do not work. So truly, out-of-pocket expenditure is not the best. It can push people further into poverty. Even people that thought they were so comfortable and they had so much money, sometimes an illness comes and it wipes away all your savings. The other option is tax-based financing. This works well in some countries, but the challenge is if you are in a country where it's difficult to know who is from that country, how many people we actually have, how much is each person earning, how much will be calculated as tax, especially in the informal sector where it's difficult to even determine how much some people earn, because it's either on a daily basis or a weekly basis, and it varies according to the seasons, whether it's farming season or not. It makes it a little bit challenging to run a tax-based system, because for this to work you need money to be regular and available to be able to purchase all the drugs and pay all the staff that you need. So this one is a bit challenging. Another option is free healthcare, in quotes. The truth is that nothing is really free. It may seem to be free, but somebody somewhere is definitely paying for that. So even though it may appear to be free, it's only free for usually a period. And then after that, what next? People are usually left stranded. So it's not often the best option, and there might be some hidden charges somewhere, or somebody who is paying for it might not be able to sustain that payment for some time. Another option is community-based health insurance, sometimes called mutuals. In this case, it's social solidarity. The community comes together and they utilize local resources, maybe a community health center, local staff, people who live within the community or run the health center, and they usually contribute a flat rate and put that money together and get some of them to volunteer and coordinate that activity, pull the funds, buy drugs where necessary, register people and stuff like that, which is quite good in mobilizing the community. The challenge may be that there's a limit to what they can treat at that level. If there's no linkage to other services, maybe secondary healthcare referral system is a little bit difficult. If it's not integrated with a bigger scheme where you have more people, if you have only limited people, it's a bit of a challenge. If you have one person with a serious illness, it can come and wipe out all the funds that they have saved for an entire year, and they may have to start from scratch. So there are lots of challenges with this. Also, the capacity of the coordinating of the community in terms of technical capacity and in terms of financial capacity, it's a major challenge. Then let's move on to another option, which is private health insurance. Talk about private health insurance, usually run by private for-profit organizations, and basically what you pay is a premium, which is based on a risk assessment. So whatever you pay depends on, if you have, for instance, hypertension, and you are tested, you check, okay, fine, they say, okay, based on this hypertension, and also based on what you want a very big package that involves maybe flying you out on an aircraft in case you have a stroke, or you come down with something serious. All those things are used to calculate your premium, and you probably be paying higher than somebody else who doesn't really have any other what we call previous illness. So that's for private health insurance. You usually pay more, depends on any pre-existing condition, and the package can be as large as whatever it is, so far as you're ready to pay. And so for private health insurance, the poor are usually excluded, and it only takes a small percentage of the population, so it doesn't cover quite a number of people. And then that brings us to the last one, which is social health insurance, which is what we do at the NHIS. as the name says, social. So it's for the good of the majority or all of the population. It's for everybody. Payment is based on ability to pay. It's more pocket friendly. It's more inclusive for those who are not so ability to pay. It's more pocket friendly. It's more inclusive for those who are not so well off, and we'll try to get everybody involved. And in 2015, the NHIS facilitated the implementation or the setting up of state health insurance schemes. So now you hear that states are having their own state health insurance schemes, and the national remains the authority that coordinates all of them. In addition to also running some schemes, for instance, for the public sector, which is the ministries, departments, and agencies. We have the Federal Civil Service staff, and the armed forces, and other agencies of government. For them, the employee, his spouse, or his or her spouse, and 4 biological children under the age of 18, they are all covered, and they pay a percentage of their salary, and the employee also pays a percentage of their salary. That's the way it's supposed to be. And then also for the organized private sector, that's supposed also the same thing. Employee pays, employer pays, and that's for organizations in the private sector that have 10 or more staff. Currently, it's based on request. The private organizations have to indicate interest. But now that the NHIS Act 2022 has been signed, and health insurance is now going to be mandatory, all organizations will have to, all individuals will now have to have one form of health insurance or the other within the country. We also have the GIFSHIP, what we call the GIFSHIP, which is the Group, Individual, and Family Social Health Insurance program. And that's for various groups, individuals, and families who are not covered under the other programs that I have mentioned for the public sector and the organized private sector. Already we are covering the NYSC, the retirees, constituency projects all across the country. So the way it's categorized, 1 to 3 individuals is the individual, and that's going for 45,000. Then we have from 4 to about 9 people, 4 to 9 is the family, okay, and that's about 60,000 for a family of 4. And then for each extra person added, we pay 15,000 up to a maximum of 9. And then for the groups, which is 10 or more people, pay 15,000 per person. And it's important to note that there is a waiting period following the registration or enrollment, and there's also an additional waiting period before any major surgeries for the GIFSHIP. And it's important to renew that before it expires, 2 months before expiry, so that you don't need to go through the waiting period again. There's also the Basic Healthcare Provision Fund, which we are implementing. Some of you may know that Section 11 of the National Health Act establishes the Basic Healthcare Provision Fund. And NHIS is one of the gateways, for the Basic Healthcare Provision Fund. 48.75 of that money, which comes from the Consolidated Revenue Fund, at least 1% of it, from donors and from other sources, passes through the NHIS, is channeled to the state health insurance agencies, and then goes down to the facilities where it is used to pay for healthcare services for the vulnerable populations. And so what you can see from what we are doing, we are mobilizing the funds from various sources, taking money from, or mobilizing money from people's contributions, from the government, the 1% of the CRF, which is the BACPF, from donors, if that also goes into the BACPF, also mobilizing funds from employers, and there are other innovative sources of financing, and all that money is pooled together, and then it's used to purchase or pay for care from accredited healthcare providers. We do accredit healthcare providers. They go through a process, and we classify them as primary, secondary, and tertiary healthcare providers. And even after accreditation, we still go back to do quality assurance checks on these providers, especially through our state offices. We have offices in all the states of the Federation, and indeed we even have 2 in Lagos, and we also have zonal offices at the moment. And so it's also important to know that the benefit package that we have, what I mean by benefit package is all the benefits what the enrollee after registering is entitled to. For instance, you're entitled to consultations, some laboratory tests, medications, it's a 10% co-payment on that, and also emergency services, among others. So it's quite, this is just an overview, it's quite a detailed benefit package, although there are some exemptions in terms of home visits. It's not allowed. The doctor can come and see you at home. You cannot get contact lenses, for instance. You cannot get cosmetic surgeries, and we don't handle epidemics and family planning commodities because we have sister agencies under the Ministry of Health that handle those particular cases. And so this in a nutshell are some of the programs that we have designed to be able to cover all Nigerians. With the signing of the Act, we'll be working a lot harder to fast track the coverage of all Nigerians, and also coordinating all the actors within the health insurance system through the health insurance under one roof initiative. When I say actors, I mean, I've mentioned quite a few. We are working with the state health insurance agencies, we're working with the health maintenance organizations, we are working with the enrollees as well. There are some mutual health associations, or the community-based that I talked about earlier, and there might be some third-party administrators as well. So there are quite a number, and of course we're going to be interfacing with our sister agencies and the Federal Ministry of Health. So, and donors as well who work with us within the health insurance space. So we work with quite a number of stakeholders. And very quickly, I just want to mention that we have been working assiduously over the past few years, 3 years to be exact, to put in place quite a number of things that will make life easier for our enrollees and make it easier for us to cover all Nigerians. For instance, we have developed the NHIS Medicine Supply Initiative, where we are branding some drugs and also working with some pharmaceutical companies to bring down the cost of cancer drugs for our enrollees. We are also working assiduously. We have developed a 10-year strategic plan. We are meeting regularly with our stakeholders. We have instituted a lot of capacity building. We have a leadership development program that is ongoing, and so many other reforms that are going on. A lot of research. There's also the ICT aspect of it that is ongoing, and so we are looking forward to improving our services within the next few months and years as we continue to move forward and work with all our stakeholders to make sure that all Nigerians have access to quality and affordable healthcare. Thank you so much. Thank you.
All right. Wow. Thank you so much, everyone. Welcome back. I think we've had so much information now from the private sector and also from the government from Nigeria. I'm happy to hear so much about what the government is trying to do, and also listen to it from Dr. Awoyinfa and the rest. Dr. Vera, are you joining us? So we have one of our directors also here with us.
Yes, I'm here. Good evening, Ma. Good evening, everyone. Just backstage.
So we will be going to the question and answer session now. I think Dr. Vera will just help me a little bit with the question and answer session. So I can see a lot of people, I hope they didn't get tired with all the presentation, but I really think I think everybody has addressed the core issues of how you can pay for your health. And I think if I can summarize it, this you can't pay out of pocket. It is not going to work. I think that's my own learning from this. And so you have two options of insurance. You have the HMOs, the private health insurance, or you have the NHIS, which is a Nigerian, which is a called social insurance. So in other words, you pay part of it, but the government also pay part of it, and they are trying to sort it. So I hope we are all listening. And some of the figures are really not they are not that much, not for you to get insurance. So, and most of us in Nigerians, we pay a lot. People will pay makeup. They will do 50,000 naira makeup for 2 hours. And yet they will not want to pay 50,000 naira for insurance for 1 year. It's always so amazing to me. We do Ashrebi, all those Ashrebi people buy every Saturday. And they go for maybe every month, or at least one. And yet we won't pay for health insurance. Then when it is time for health, so if I'm going to summarize what we have learned today, health is not free. Forget what the politicians told you. Health is not free anywhere in the world. Somebody has to pay for it. Two, is either you pay for it yourself, but paying out when you need it is not going to work. You have to pay ahead through insurance, which is cheaper that way. You can do whether government owned social insurance or you can do private insurance, and your insurance depends on what quality of care you want. I hope I've summarized well for our erudite speaker. I'm trying to put it down in the layman's language. All right, so if you have questions now, you're free to ask your questions. Then our guests are still in the house. I can't see any question on Instagram. I can't see. Okay, we have a question here from want to give a baby that normally forget something. Please, for any health questions, post to our Facebook group. We will answer it there. Today, we want to talk about health finance only. Okay, so Madu Adaize says, the only government's works that register for NHIS? I think maybe, Madu, do you mean Adaize? I think you mean, is it only government workers that can benefit from NHIS? So who wants to answer that for us? Temi, do you want to tell us the answer?
Sorry, excuse me. You don't have to work for the government to purchase the NHIS plan. Individuals, private individuals can purchase the NHIS plan, NHIS platform. You don't have to be a government employee to know.
Okay. Oh yeah, ask questions. So okay, somebody said there's echo. We are sorry about the echo. Unfortunately, I have to play a recording of the video, so because Dr. Nnenna is not able to join us, so sorry for that. Okay, do we have any questions? I'm not seeing questions. So, Dr. Vera, do you have questions? Okay, I'm not sure Vera is here with me. Okay, I'm not sure we have.
Yeah, yes, I'm still here. I'm just going through the comments to see if there are questions.
Whether there are questions, yeah, because we can't see some questions on the group, but we can see questions on the page and only ask. Okay, but let me ask the question. So, for Temi, can you give like I'm a typical Nigerian mother. I'm earning 30,000 naira minimum wage. What do you advise me in terms of how do I pay for the health of my children? What package will somebody like me, any 30,000 naira a month, be able to afford?
Okay. Thank you for that, man. Let me start. Healthcare itself. Healthcare is not even of with the exchange rate now. We are seeing schools asking for a review in tariff and changing their prices. But however, for that person that earns 30,000, maybe the private HMO may not be a suitable option for you. So, but there are lower plans, the NHIS, that will just like cover the basics, because majority of the outpatient cases are malaria or correct me now, Dr. Gbemisola, yeah, urinary tract infection that people are treating nowadays. So if the policy is able to purchase can just cover the basics for you, that is a relief on it. You don't have to pay much for the NHIS plan. So that plan is like I owe you say about 8,000, 7,500 for that particular. Get that on the NHIS platform. For someone that has that earns that amount. But if you still have more disposable income, then you then go for the private HMOs that have a wider scope of cover, wider range of hospitals that you could expand Nigeria, increase benefit. You can talk about dental, optical, you can talk about maternity, or maybe a limit on chronic cancer. With more disposable income, you can then afford higher plans as you go higher on the pyramid. So that what I would.
Okay. So thank you, Temi. So
Thank
Dr.
you, Tony. Yeah, let me just add something.
Okay,
So you
yes,
said
go
a
ahead.
woman on 30,000 naira.
Naira.
Yeah.
Mm.
Yeah, my advice to the lady is the cheapest plan now in the market is the Lagos State health scheme. They call it
Yeah.
Ilera. Yeah. So, and the good thing is that they allow for quarterly payments.
Okay.
So I think monthly is about 1,000.
Okay.
Yeah, it's about 1,000 per person. So if you are paying for the whole year, I think it's 8,500 for per person and 40,000 for a family of six. You can't get anything cheaper anywhere else. But they
40,000 for a year.
yeah, for a year, 40,000 for family of six, 8,500 per person, which comes to about 700 naira a month. But there's a catch. The kind
Oh,
of hospitals that Temilade would give you on our own plan is not accessible to you on that plan. No.
what kind of hospitals are accessible to
Okay, so
me
they,
on
they
that
will be
plan?
accessible to maybe PHCs and general hospitals.
Okay.
That is the catch there. You know, the more you pay, the more benefits you have. So, for example, in private health insurance now, the cheapest HMO plan that makes sense would probably be about 30 to 40,000 a year per person.
Oh, is that not the same thing as your Ilera Eco? You say it's
No,
40,000.
Ilera is for that 40,000 is for a family of six for a year.
Oh, for six people.
Yeah,
Oh,
in a
okay.
year, in 1 year. But
Okay, but
for private health insurance, that is the price for
one person.
one person. But you get
Yeah.
more benefits and you have access to private hospitals. For example, God forbid they need an emergency, they can go to any hospital, whether they find themselves on the mainland or the island in Apapa, anywhere, you are covered.
Yeah.
So
Okay.
that's the catch between the two. And the what's it called? The Ilera Eco, it allows you to pay quarterly and you have access to also even they started the telemedicine platform too
Mm.
for the
Okay.
Ilera Eco. Mm.
Yeah. So, uh, can you, Dr. Oyefa, can you clarify for those who don't have the Ilera Eco plan, going
Yeah.
to the PAC and the General Hospital versus those who have the plan? What is going to change now? Because all of us are used to going to General Hospital anyway for without any plan, and we expect our children, at least children, to be treated for free.
Yeah.
So now that Lagos State is starting this new insurance scheme, what is going to change?
Okay. The first thing that is going to change, I like you started at the beginning of the program. You mentioned that immunization, they take to pay for needle. Under Ilera Eco, nobody's going to ask you for anything.
Okay.
But if you didn't have a Ilera Eco, if your wife wants to give birth or your child needs anything, you know that pack, they give you this list of what to go and buy now. What
Yes.
the Ilewe Omo. And I tell people that even Ilewe Omo is collecting 40,000 now per child.
Yes, they collect
I
money
know
too.
when I talk to people, I'm wondering, I said, why are you paying 40,000 for Ilewe Omo when a gynecologist is charging you less than 30,000 in a what's it called? In a public facility. But no, I don't know whether it's culture or I don't know. People just I like the way you mentioned Ashwebi and
Yes.
what's it called? People people would
I,
rather
yeah.
people rather pay for what they like. Like for example, I was telling someone today that I had a friend, he has a telemedicine app. He was now complaining to me that people are always deleting his app. I said, why? He said, anytime any new musician comes in, whether it's a portable or Davido, the first app to go on the phone is the telemedicine app to make space for Davido or Burna Boy album. Then after the album, where is that telemedicine app that they were telling me? They already deleted it. So there's no reason for for using the app, and he was going to do the app for free. He said, but he's in competition with so many people because people would rather watch a skit of a comedian. People will spend 4 minutes watching macaroni or watching what's the name of this other guy, the funny people, the guy
Yeah,
that shouts.
yeah.
Exactly. I've forgotten his name. The guy, there's one guy that shouts and has a lot of followers on social media. But people will spend 3-4 minutes watching that. But if you tell them to use telemedicine app and tell the doctor that I'm not feeling well, they said no. The thing is not easy to download. But this kind of person will take his time and watch 4 minutes of his skits comedian, spend 1 hour abusing people on Twitter. But when it comes to paying for healthcare, they're not going to want to do that.
Different. Okay,
Exactly.
thank you, Dr. Oyefa. Tell me, do you think it's ignorance? Because, like I was saying, I see a lot of Nigerian women. We buy Ashwebi. Most Akara now is maybe 7,000 naira. And that Ankara will pay for health insurance for at least the minimum we are talking about now is about 8.5 or something. So in other words, in 2 months, if you don't buy Ankara, you will pay for your health insurance, and then you can always take your children to hospital. You don't need to be worried about paying for the health. You see that our people don't know about this. What are you doing as an organization, as the HMOs who are doing this insurance? What are you doing to get people to really to our level to understand that all the money we spend on data, we spend on Ashwebi, we spend on what else do we spend money on, makeup and everything, we can actually use to pay for the health of our children. Because I see people really don't want to pay for health because they believe that health should be free or somebody should do it for free for them. What can we do to increase the awareness? Let me put it that way.
Thank you, Dr. Gbemi. It's not just lack of awareness, even though that is all encompassing. The lack of awareness is there. Another region. Another thing is our policies. Our policies. Also, another thing I would say is priority that people have placed on it. So ignorance is there. Yes, I agree. But however, even those that still know about it, there'll be one excuse or the other. And again, that it is not top of the priority list. So we've gone so far as low as creating a minimum plan. Dr. Awoyinfa said our plan may not be as cheap as the like the Lagos
NHIS.
NHIS or the Lagos State they have done. But even though there are people that that can afford this health insurance, afford my minimum plan about 40-something thousand naira, and about that they have that fund available. But come buy the health insurance. They just would not buy. This is the same person that will hold a 40,000 naira bag, that will buy a 200,000 naira hair, and you do not have.
Yes, so I didn't even go into that one.
They are they are yet to prioritize, but not to also blame them at the other end of it. Health insurance over the years in the past have not gained the trust of the populace.
That's what
So
Dr. Rotimi is just posting now.
yeah,
That
so
the back is
in
that the attitude of the health workers turn them away. That's it.
the attitude of insurance company as a whole, whereby insurance company may not know of you're an insurance company, you're in the business of claim. You're in the business of paying money out. So insurance company in the past years, maybe 20 years ago down the line, have failed Nigeria. It is now that insurance companies are picking up and people are gradually having to have trust in the insurance company. So now also retail plans, initially they did not used to have individual plans that people can buy. One of the available were just corporate plans that people can buy. So retail plans are available now. People are beginning to trust insurance companies more. And I also think is the another thing about awareness is also has to do with education. The more educated the populace, the people are, the more they are aware about health insurance policies. Even the one of that the Lagos State has done that are available as cheap as that they've even advertised, talked a whole lot on the radio in Yoruba, in English. Penetration is still a bit low. So as Dr. Awoyinfa said, I think we still need to find a way to ensure, okay, people pay for it without them knowing. Out HMOs will advertising on TV all the time, but again, how many people listen to this? They rather listen to their Echo FM that's Yoruba. Yeah, we still there, but again, is a priority. I would say, okay, religion. Religion has a role to play also buying health insurance. They'll say, oh, I would not be sick. I will live. I will not die. It's a whole lot of course, we believe in God. I believe in God. I believe that I will be healed. I believe that I cannot get sick. But at the same time, things can happen. Things can happen. My child, that I have faith that I will not be sick does not mean that my husband has the faith that he would not be sick. But what then happens does not mean that my cousin has the faith that he or she would not be sick. What then happens if the person needs a form of health care and a particular form for a particular health care need? So by the time we all come like that and buy health insurance, what we are actually even seeing is at the point of care that people then want to buy. They are aware of health insurance. It's at the point whereby doctor has said, my son needs a surgery costs 2 million. You now want to put your naira at that point of that's no probability. Should you in the future needs XYZ, the insurance company would pay as it pertains to your policy. People are then removing the probability. By the time you remove probability, it's no longer insurance. It's now what we like call is an NGO or like ATP that wants to pay for your health hospital. So the thing that we are speaking about, people are aware about it, but again, it is the priority and the consciousness that has not dwelt in the heart of people. And I think with time, I don't think language from now. But again, content, we're happy that on this platform, people are just hearing about health for the first time, and I'm happy that we're able to. Thank you.
Okay,
Right.
so Dr. Gbemi, please 1 second. Let me just quickly say
Yes, go
something.
ahead. Go ahead.
Thank you so much, Temilade. Thank you so much, Dr. Awoyinfa. It's been insightful listening to you. A quick question I want to ask. I hear okay. I hear everything that we've been saying, but one of the things that I've heard people say in the last maybe 5, 7, 10 years is the fact that sometimes you are connected to a hospital via HMO, you get there and you are badly treated, but the people who are connected to the hospital as private patients get the best services. So do you want to tell, because really you've all told us, and Dr. Gbemisola nicely summarized the thoughts around the fact that we may not be able to pay for healthcare. So if the NHIS, HM, and all of these are our options, how are these companies, these organizations able to help the populace believe in the fact that they really care about us, and we would get as much regard, as it were, as the not on the same level that is, but to an extent, some level
I
of
get your point, Ali. They show you some bit of empathy and
something like that.
okay.
And that's one part of my question. Then the next question would be that yes, there are people who have good HMO but have not been able to utilize or optimize the kind of offers that they are supposed to get. So how can an average person leverage his or her health insurance well, such that you can get the benefits? I mean, what are the steps, practical steps that we can take? Okay, I get to the hospital. Is there someone I'm supposed to speak to? Is there somebody I'm supposed to ask a question, and all of that? These are very important things that we would like you to talk about on this show. Thank you so much.
Okay. Thank you, Dr. Vera. So I'll go to the first question. Dr. Gbemi, can you remember some years ago when you were at Reddington and I was in Red Care? You know, we had this same issue whereby people will complain that those that pay cash were getting better treatment than the Red Care enrollees. Meanwhile, they were both owned by the same group of companies. Unfortunately, there's nothing anyone can do about that. Whether it's Laguna, Nigeria, whether it's Red Care and Reddington, cash is king. Everybody will move towards the person that is paying now. Because the HMOs, just of recent, in the last 5 years, HMOs have started paying maybe weekly or daily or monthly. Before, about 10 years ago or 5 years ago, it used to be a 30-day or 60-day cycle. But now, if you can send your bill on time, you'll get paid within a week. So I get the thing that people feel that they don't get as good the service as those paying cash. Unfortunately, that's the reality. And I mentioned earlier that there is nowhere in the world, if you show me your money and somebody is saying that they are going to pay me after 30 days, it's unfortunate, but I'm going to give the person with that is paying cash more attention than the person with the HMO. It's unfortunate, but that's the reality. So what HMOs have done is that they keep on training front desk officers every quarter. They make sure that nobody is discriminated about. But unfortunately, if you don't continue these trainings over and over again, by the next time you are doing your training, the front desk officer has changed hospital and moved to another hospital or another state. So the HMO has to start afresh. That's number one. Number two, for the NHIS and the state schemes, Dr. Rochmi mentioned earlier that the attitude of workers in public hospitals leaves much to be desired, because they will tell you that that they are not happy with the conditions of service. So unfortunately, they take it out on people that come. That already is a turn off for people that want to use the public hospitals. So it's a continuous advocacy thing that people keep on advocating about, that there is no way everybody cannot afford to pay for healthcare. So we must find a way to, tell people that are using health insurance that you will not be discriminated against in any hospital, either public or private. Then your second question, I tell people all the time, if your HMO gives you a lot of channels whereby you can liaise with them. So what happened that the average Nigerian is not going to go to the hospital unless it's a serious case whereby you have Googled your symptoms, you have gone to the pharmacy or chemist, you have not gotten relief. That's when you remember that, come on, this thing is more than my power. I'm not working properly. I'm not feeling too well. Let me now use my HMO. But the HMO has a lot of channels whereby some of them have apps that you can chat with them. They have numbers, toll-free lines you can call them. And I always tell people, even if you don't fall ill in a year, the least you can do, go for your annual health check that your HMO will do for you. Because some people will tell you that I don't fall ill, I don't need my HMO. It's my wife and children, it's the children that use the HMO. So I always tell people that once you have an HMO, I beg you, I plead with you, try and get one of the numbers on the card, save it on your phone, because you never know when you will need it or a family member needs it. And if, as God wants it, you didn't have any healthcare needs during the year, then before the end of your health plan for that particular year, you can go for a health check, whereby they do your kidney function, liver function, BMI, random blood sugar, just to make sure that at least you are utilizing the care. So there are different channels for people to use their HMO. And I wanted to mention two stories to you to show you how health insurance is very funny in Nigeria. So during COVID, some organizations decided to pay for vulnerable people. And they told those people that the only way we are going to pay for you is if you to pay something small, like people in the informal sector. So there was this lady that she paid about 1.5 a month, and the organization allowed her to give birth in Lagoon Mikoyi. So without her 1.5, her bill, she had a CS, so her bill came to about 600,000. Do you know when they wanted to use this lady for marketing promo? She said, "No, you can't use me. I'm going home." And everybody was surprised that, but madam, you paid only 1.5 now. He said, "Am I owing you money?" They said, "No." He said, "I don't want my face to be on any commercial." He said, "But we need you to encourage people to use." He said, "No, I'm not interested. I'm not interested in your scheme." because she felt
Wow.
that she had already used their head that with my 150, I've gotten 650,000. So maybe they want to what's it called, and she went away. Under that same scheme during COVID, this was April, May 2020. There was another driver who was earning 60,000 a month. His guy now told him that, do you know what? I have health insurance, you don't have. So what I would do from your 60,000, I will take 2,000 naira and pay for health. He said, no, if you can't give me the money, leave my money that way. It's either you give me that 2,000, let me go and pray for against bad things happening to my family, or you leave me the way I am. You know the way Yoruba say it now, that any oracle or higher power that can't help me, leave me the way I am.
Mm-hmm.
So 5 months after, guess what happens? He calls his guy around 3 a.m. He said, Oga, he said, what is the problem? Hope no problem. He said, I can see the head. He said, head of what? His wife was pregnant. So they were in the PHC. His wife was already delivering. He had no money. Do you know the 2,000 that his Oga was telling him 5 months earlier would have paid for the delivery of that child? His Oga had to send 50,000 to him at that point in time at 3 a.m. in the morning, because the hospital had already told them that we are going to arrest you and your wife if you don't pay us. So you can imagine a man that had the option of paying 2,000 a month every month, he refused. Then 5 months down the line, he had to call his boss around 3 a.m. to send him 50,000. And I said, how many people? There are some people that won't pick up your call at 3 a.m. or 4 a.m. now. So imagine what would have happened to the poor wife and her unborn child, just because he didn't
Wow.
want any deduction. So it's
Wow.
a continuous conversation. We have to keep on pushing,
Yeah,
and yeah.
absolutely. Absolutely. Right. Thank you so much, Dr. Awoyinfa. Thank you. Thank you. Thank you. I'm sure our viewers are learning a thing or two from this session. Temilade, do you have any addition, anything you want to say concerning those questions from your own perspective? And you also want to mention something about let's even know if we want your health care doctors on this call. What is your minimum plan? Do you have plans for people who don't really have money but they need to live? I mean, these are practical steps that we want us to add to this conversation so that people who are seeing this video right now or would watch the replay would know that, okay, by virtue of this meeting, I know that I can get this care here, and here, something in that line. So Temilade, please give us your addition if you have. Thank
Thank you very much, Dr. Vera. Let me start by saying as Dr. Awoyinfa rightly said, it's a cash society, but also people are beginning to understand that health insurance is here to stay, that HM is here to stay. So that's gradually. And one of the ways in which we may help to meet all those bad attitude that we are sensitizing the hospital front desks quarterly. Another thing is that for the HMO, we have also provided various channels in which our clients,
you. Oh, Temilade's network, I guess.
my network,
Okay, great. Okay, please continue. Thank you.
we have also provided various channels whereby we can help mitigate at the hospital end.
I'm
So,
not sure if it's my network or yours, but do you want to just start your conversation from the beginning?
okay,
Just
what I saying that regarding the behavior at the hospital and regarding those that pay cash and the HMO patient. Yes, as Dr. Awoyinfa said, is a cash society. But another thing Leadway Health has done to like reduce that mindset or that attitude from the hospital end. One is to ensure that we pay hospitals on time. So we pay hospitals, the hospitals that want to be paid daily, they want to be paid weekly, or they want to be paid twice in a month or monthly. We have that option available for all hospitals. So to ensure that, okay, at the end of the day, you know that you are going to, okay, get your money. Leadway as a HMO also has a very strong financial backing. As a group on its own, as an entity, we've been in the insurance business for over 50 years. So you could know that in Nigeria, for a company, for an indigenous company that has spanned over all these years, it means that, okay, there's something that this brand is doing right. So hospitals have that confidence in all that it will pay claims. So another thing also, we also provided various channels that the clients can reach back to us. So there's a WhatsApp platform because most people are on WhatsApp these days, whereby if you're having a forgive me for my choice of word, a shitty experience at the hospital, you can WhatsApp our call center agent, like, okay, I'm being delayed at the hospital, they're not attending to me, what can you do? Then we can then reach out as a HMO to the hospital, okay, what's causing this delay, what can we do, what is the problem why the client being delayed. Also, all those platforms that we have created works 24 hours, 7 days a week. So these are not machines that will respond to people. There are people that are stationed there that work in shift that will respond to all of your needs and all of your inquiries. Also, I will also say regarding health insurance, just a funny joke. One of the things we know, some people say, okay, when I pay for health insurance, I don't go to the hospital. Will you give me my money back? And sometimes I'm like, it's insurance. If I pay claims, will you give me the HMO my money back? So the thing is that you are contributing to a pool of funds whereby funds are pulled out to cater for you should you fall ill. But Dr. Awoyinfa said there's a health check or a comprehensive health check benefit on your plan with listed tests whereby you can carry out on an annual basis to find out the status of your health. Okay, you asked me about our minimum plan, what it covers. We are looking at creating a micro insurance plan. We've not finalized that product. We'll finalize this. I'm sure we'll finalize before the end of the year. But however, our current minimum plan will cover you for maternity, be it a cesarean section or the vaginal delivery. It will cover you for optical care, surgeries, dental care, just for just a little amount of money. So our lowest plan currently on the retail end goes for about 48,000 naira per annum. However, 48,000 naira, if imagine if you are to collect drugs at the hospital, if you are to collect drugs at the hospital, if you are to see a doctor every day, it covers you to a reasonable extent. Of course, our retail plan, there are some waiting period on some lines like maternity. You cannot access maternity in the first year. This is just to ensure that okay, people are not just buying it for just maternity case. But if you are looking at having a child in another year, in another maybe next year, after a year or another 2 years, why not buy your health insurance plan now so that by the time delivery comes, this health insurance plan will kick in and cater for such delivery for you at the hospital, whereby reduces the amount of money you have to spend out of pocket. So our basic plans, I said, will cover you for maternity, be it normal delivery, cesarean section, will cover for child immunization, specialist consultation, will cover for chronic conditions like diabetes, hypertension, will cover for cancer care to a financial limit. So to a reasonable extent, this gives you the basic cover really. There's no limit in the treatment of ailments like malaria, urinary tract infection, other minor things. You don't have to pay out of pocket for it. So I ask people, I will tell people, buy your health insurance plan today. Also, by the time that little amount of money and the benefits you would get, it cannot be measured. The benefit outweighs the premium being paid. So you're talking about getting a benefit worth over hundreds of thousands of naira or millions of naira, depending on the plan that you purchase. I don't know. I hope that has clarified your question. Thank you.
All right. Thank you so much. Okay. Vera, are you responding?
No, okay, I was going to say yes, yes, indeed.
Thank
Thank you so much, Temilade. Thank you.
All right, thank you, our special guests. We didn't really have a lot of questions. I think, as usual, Nigerians, these are the important things. They, they ran away from the important topic, but do think that it's a video presentation, so we have this video. So next time anybody is telling me they don't know how to do their health, thank you for giving us this resource, which we're going to put together and we're going to put it in our group. I think if you have any information like flyers or things like that, Dr. Awoyinfa as well, if you have any of those things that we can put on our group for our members, that, something visual for them to understand
Okay.
insurance, what they pay
Okay.
for, what they get. You know, I think sometimes
Okay.
people don't recognize, they don't know it is this.
Yeah, I agree with you. They like audio visual, maybe like a 1 minute video.
Yeah, I'm
That,
not sure they are. I'm even talking of the
a
cost,
flyer, a
the
flyer, yeah,
basic
a flyer.
cost, and I'm not. We're not going to do advertisement for any particular HMO, but
No, not for any HMO, just a
yes,
general.
the market rate, like this particular plan, this is what they offer, and this is the cost to you for a year, and this is what they will cover you. You know, but I think the most important thing is also for our HMOs, our health insurance people, to make sure that our trust, we can trust you, like, because I think Vera has really handled that part. So I'm not going to belabor the point, but I think, yeah, people really doubt, yes, that sometimes you want to just give us the cheapest drug, the most generic drug, just because you are trying to save costs, and all the money is going into the company, riding nice cars and everything. So at the hospitals, I've worked in hospital, I work on both sides. And I know that when I was working in private hospital, that sometimes we would tell some HMO people that we won't see their patients again before they will pay us. So that is the truth. So sometimes these are the challenges. So I remember my MD then were like, these people from this particular insurance don't see their patients anymore until they pay. So, and because the hospital people have to pay their staff, and it is when the money comes in and all that. So these are all I think it's the trust issue is also a major issue. But I'm happy that you said that the trust is being rebuilt. So we're going to trust you. And now the government is also involved. So I know I pay for NHIS all my life in loot, and I never spent one kobo out of that money. I never go for anything. So again, because I don't know, maybe it's my fault, but I guess because I'm always around healthcare people, I know how to sort myself out. But I'm just saying these are the challenges that people, even when they pay, they don't utilize those resources. So we look forward to a better Nigeria. I think I'm more encouraged this evening listening to all of you talking about all these options. I think people now have options, and we have no right to complain anymore. And if we are paying, whether it's the Ilera Eco or whichever plan, whatever, then we have a right to demand good service because we have paid for it. But before, we are always begging, begging, begging. And I also, I'm looking forward to how an organization like ATP, we can partner with, or get involved in some of this. I guess we will be more involved in things like social insurance and all that. We actually do some kind of subsidized healthcare, but we don't want to involve HMO because of all these stories and trust. But now that we are knowing that things can be better, maybe it is time we can start having that conversation. All right. I think I just want to end up by thanking you so much. Let me start by thanking Timmy. Thank you so much for giving us that beautiful perspective on private health insurance. And thank you so much. Really appreciate you for making time to be here with us. I also want to thank Dr. Segun Awoyinfa, who
It's a
has been my.
pleasure. It's a pleasure. Yeah, thank you.
Thank you for taking us through the history lessons. I really appreciate the fact that we've been talking about health insurance since before the military. And yes, we are still here. And I really want to thank Nnenna in absentia for sending the video. She's still at work. That's why she couldn't join us. But I really, for the first time, I understood what NHIA is doing in terms of health. I'm always not sure what they're really doing, but I think she tried to simplify it and I understood. So I understood all the various options. I think my job is to take this back to ACP people and tell them this is option 1, option 2, option 3, depending on what you want and depending on what you have. But I guess even the woman who is earning 30,000 naira minimum wage, she can pay 700 naira a month. Because most of these women buy Ankara, I know they do. And they do a job to buy those things, so they can pay for health insurance. I think people need to start valuing health. We need to start realizing that there's no free lunch. We have to pay for our health. And the way we pay for private schools, Dr. Vera is here. Even the woman that is earning 30,000, she's sending her children to private school because she values their school.
True.
She's paying for private education, so there's no
True.
reason why she can't pay for health insurance. So we have to pay for both, of course. So thank you so much, very much. Dr. Vera, thank you so much for coming to stand in for me last minute because I was having some emergency on the side. But thank you so much for stepping in. Thank you, everyone.
My
So,
pleasure, ma. Thank you for having me.
Thank
so
you.
thank
Thank
you.
you so much, Doctor. Thank you.
We look forward to seeing you again some other time.
Okay.
Well, I guess we're still going to have part 2 of this conversation because I think it's a conversation I really want many ATP people to listen to. I'm not seeing the number of people I really want to see on this platform today, but we're going to have this conversation again. So when we call you again, please, we hope you'll be here to support us, to
No
educate
problem.
us. I think that's the number one thing. Like Temi said, education, awareness. We need to work on that. I think many people are not aware. Really, I want to believe they are not aware. So maybe we'll start. We'll join you with the awareness part, and then we'll see how it goes. Maybe we'll start looking for how to negotiate for those on ATP. 700,000 of them, if they all get health insurance, that is a significant number of Nigerians.
I'm sure Temi will give you a huge discount.
Okay, we didn't catch what you said, Temi.
Huge discount. Definitely.
Okay, good. All right, we'll talk about that. Thank you so much and have
Thank
a
you.
wonderful
Thank you.
evening.
Have a lovely one. God
Bye.
bless.
Bye, everyone. Bye.
Thank you.
Bye.